Bismillah ar-Rahman ar-Rahim. This is the Practical Immunology, edited by Professor Dr. Batul Mutar Mehdi, MDC HB MSc, Fellow Iraqi Commission, Medical Specialization, Clinical Immunology, Consultant, Clinical Immunology. The aim of immunological tests first to diagnose the disease and follow up the progress of the disease and determination the prognosis of some diseases. The principle of any immunological test is first of all the Fab region of the antibody binds to single epitope of an antigen lead to formation of immune complex. And the second step, binding of another Fab region of another antibody to another epitope of the same antigen, which is called a cross-linking. So here we have the antigen and here binding, first step, binding of the Fab with the epitope, and then binding of another antibody with the another epitope of the antigen lead to formation of cross-linking. When there is an antibody access in this zone, so there is no immune reaction. When there is antibody equal to the antigen, so this is called zone of equivalence, and there is lattice formation, and there is a reaction. And when there is an antigen excess, so there is no reaction, which is in the antigen excess zone. So the reaction occurs only when there is equivalence between the antigen and the antibody. And the types of the immunological reaction, either a precipitation, agglutination, or immunoassay using conjugate like fluorescein, enzyme, radioactive material, or chromogen. First, we have the precipitation reaction. In this type of reaction, both antigen and antibody are soluble, and we use semi-solid agar, which is called the agarose. The type of reaction in this precipitation reaction, two types. Double immune diffusion, which is called octodony according to the name of the scientist who discovered this, and the second, single radial immune diffusion. So double immune diffusion, that both antigen and antibody diffuse in the media, in the agarose media. So this leads to precipitation, line of precipitation, and this is called identity, which is continuous line. And there is second type of reaction, which is called non-identity, which is mean this, or cross, which is mean this antigen is different from this antigen. And the third type of reaction, which is called partial identity, which is lead to formation of a spore, which is shauka. And this is that means that this antigen had partial identity with this antigen. The second type of the immune diffusion is single radial immune diffusion, and here the antibody mixed with the agarose and the antigen in the well only diffuse radially, forming a ring of the precipitation. And measurement the diameter of the outer ring, we can get the concentration of the antibody, like IgG, IgM, IgA, C3 complement amine, and C4. And this compared with the standard curve and get the concentration. And here we have this agarose and the antibody in the agarose and the antigen in the wells. And then we measure the diameter of this ring of precipitation and compare it with the curve, and we get the concentration. And more the diameter when it is more longer, so it is more concentration. And here a plate of the immune single radial immune diffusion, and this is the agarose and the antibody in the agarose mix, and in this well the antigen, and we measure the ring of the precipitation like this, like this, like this, like this, like this, and each well is before patient, and this is more clear, and we from the outer border of the ring and compare it with the graph, and we get the concentration of the antibody. The second type of reaction is the agglutination. Here the antibody soluble and the antigen are insoluble, using particles like bacteria, RBC, latex, or the attachment of the antigen with it, antibody in the serum of the patient, and agglutination will be formed as lattice. We have direct agglutination like the trypanosoma, which is parasite, which is protozoa used as a whole, and serum of the patient contain antibodies lead to direct agglutination of the protozoa if it is positive and patient infected with trypanosoma. Second, bacterial agglutination, which is more famous one, Vidal test for diagnosis of typhoid fever, and we have different types of the strains of the salmonella that cause the typhoid fever, Salmonella typhi O, Salmonella typhi H, Paratyphi A O H, and Paratyphi B O and H, or for the somatic, and H for the flagella. And we make dilution of the serum 1 over 40 over 80, 1 over 160, and 1 over 320. And the diagnostic titer is 160 and more. L indicate infection, LH indicate past infection or vaccinated. And this is the Vidal test, and this is the antigen and the antibody present in the serum of the patients, and we do this agglutination if there is latest formations positive, and if there is still suspension, so it is negative. And the another test is the brucella, which is called the rose Bengal test, and this is the which is the for diagnosis of brucella abortus, and this is the brucella antigen, and the patient serum contain the antibodies, and if it is the patient infected, lead to agglutination of the brucella antigen. Passive agglutination use latex particle coated with the antigen and detection rheumatoid factor. The antigen is the IgG coated latex particle, which is polystyrene, whitish, small sphere, small diameter, coated with the antigen, and the antibody, which is the IgM, which is present in the patient serum. And this is rheumatoid factor, which is if there is agglutination, mean positive. If it is suspension, it is negative. Another agglutination is the agglutination inhibition, which is heme agglutination inhibition used to diagnose influenza virus, and the influenza virus has a heme agglutinin receptor that agglutinate the RBCs. So if the patient's serum contain the virus, so this lead to agglutination, and other RBC lead to agglutination, and here we appear as a suspension. While if so, this patient is not infected because there is no antibodies in the patient's serum. And here we have the uh, influenza influenza virus, and add patient serum to contain antibodies. So this lead to agglutination when we add RBC. So RBC is still free, and this lead to precipitate in the bottom of the microtiter plate, lead to formation of dot, while here lead to formation of mat. And here the microtiter plate, here the dot, and here the mat. Here infected because the patient will form antibodies, and here not infected because the patient not form antibodies. And thank you.